we are very concerned about the health risks for farmers and for farm workers because of where they work and where they live. They're exposed to more PFAS if they're on a contaminated farm than your general population.
In this episode of Sustainable Healthcare, we dig into a timely issue facing farmers, families, and food systems across Maine and beyond.
Welcome to Sustainable Healthcare. I'm your host, Tim Doak. Today, we're talking about something that's been showing up in our soil, our water, and yes, even our food. Per- and polyfluoroalkyl substances, or what most of us know as PFAS. Known as forever chemicals, PFAS are synthetic substances used in everything from nonstick pans to waterproof clothing to firefighting foam. They don't break down in nature, and increasingly they're being found in places we never expected, including farmland. Joining me today is Dr. Ellen Mallory, a researcher at the University of Maine who's part of the university's PFAS Research Initiative. She studies how these chemicals move through soil, crops, and livestock, and what it means for our farming communities. Ellen, welcome to Sustainable Healthcare.
Thanks, Tim, and thanks for the opportunity to be here.
Well, it's great to have you. So let's jump right in and start with the basics. PFAS, it's a term we're hearing certainly a lot more of lately. Exactly what is it, and how on earth does it end up in our food?
Yeah, right. Good question. So, you gave a bit of an introduction to what PFAS are. They are a group of chemicals, thousands and thousands. I mean, depending on what definition you use, it can be from 7,000 to 40-some thousand. But
wow.
They all have in common a carbon-fluorine bond, at least one, or by some definitions, it has to have two. But that bond is really unique in that it's probably one of the strongest chemical bonds that exists.
Okay.
And it's what gives those chemicals their unique properties in terms of repelling oil and grease and water and resisting heat. And that's why they've been used since the 40s in a whole bunch of different products, like you mentioned. But the problem is that what gives them those, that strong bond that gives them those unique properties is also what makes them a bit of a problem because they're virtually indestructible. And because they don't break down, then they accumulate and persist in people and animals and in the environment. And that's why they're termed forever chemicals. We'll talk probably about how they're not always forever, but once they're in the environment, they travel mostly through water, but they can also travel through air, precipitation. They've been measured in precipitation. And so what that means is that they've moved around the globe. So even though they're a synthetic, purely human-made substances, they have been found in areas everywhere around the globe, even where humans don't even exist. So like think Arctic or something like that.
Sure. So completely man-made. This is something not found at all in nature.
No.
That's interesting. So once it's in the system, it just stays, or does it dissipate in some way over time?
Oh, okay. So because they don't break down, they never go away unless they are intentionally, unless we, the humans, intentionally destroy them. And you can do that. There are different technologies. I'm not really equipped to talk about them because some of them are kind of complicated, but
sure.
Most of them involve high heat or high pressure, or something that is expensive at this point to do. And so there are a lot of promising technologies, but right now they're not really economically feasible. And your first question, I forgot to talk about like how they get on farms,
right.
But I'll just say that one of the things that's unique about when they are on farms and they get there through, again, air, water, application of soil amendments like composts and biosolids. Mm-hmm. Once they're there, they're spread out over a really large area. And so while a technology that might work for water, let's say where you can filter and then actually isolate the chemicals and then you have them pretty concentrated and maybe you can destroy them, it's really hard to think about how you would do that at a farm scale. Like, how do you get them out of soil?
Sure.
How do you get them out of that extensive of an area? And so So yeah, I'd say once they're created, they are there. I will say though, it is important to sort of understand at the individual level, PFAS aren't necessarily forever in the sense that we humans and animals excrete PFAS through urine and milk. And so if we stop consuming or being exposed to PFAS, then the levels of PFAS in our body will go down. Same with animals, and that's actually a strategy of how to address PFAS contamination on a livestock farm.
So if we think specifically about food, what is the process or mechanism by which PFAS actually gets into the food product itself?
Yeah, that is a good question. So, PFAS can enter onto a farm through a variety of means, groundwater, air, soil amendments. In Maine in particular, our issue has been the historical application of contaminated biosolids, and that was wastewater, sludge, and septage. So once it's on the farm, in soil or water, plants will take it up through their roots, and then it makes its way into the part of the plant that is harvested. So let's say it's a tomato or green bean or even wheat, but we also feed those plants to animals, and so animals can become contaminated, and then PFAS can enter their milk or their meat, and then humans consume it from there.
And so how many crop cycles does it take, or do we even know yet, to deplete the PFAS from the soil?
That is a really good question, because all the time we get people asking, well, why can't we just grow something to pull it out of the soil?
Right.
And I guess, one, we know that isn't so effective because these fields that have been contaminated, since the late 80s, early 90s, let's say a hay field where people are taking plants off every year,
Sure.
2 or 3 times a year, we still have levels that are high enough to be an issue. Also, some of the studies that people have done on plant uptake let's say, there was actually a really great study done in northern Maine using hemp, and they found that for some PFAS, the shorter chains, smaller molecules, they do get a significant amount of uptake, and maybe in decades you could deplete the PFAS. But for the longer chain, like the one that I've been mentioning, PFAS, bigger molecules, the rate of uptake is just not significant enough to deplete. So it would take centuries to actually deplete.
Wow.
Yeah.
Okay. So we've talked a little bit about farming, and I do want to touch on that a little more. But first I want to talk a little bit about healthcare. You and I had an earlier conversation about how PFAS shows up, not just in farming, but in many of the things that we use here in healthcare. The tools and supplies we use, I think a good example would be like a heart catheter, right, typically contains PFAS. And healthcare, like other industries, really is working to tackle how our waste stream contributes to environmental problems. How do we even begin to address that?
Yeah, that's a tough one. I think, as a society, we have to first, the ultimate goal would be to turn off the tap, right? If we're dealing with a contaminant, let's stop producing it. Let's stop getting it out into the environment. But we also, as a society, have to have some discussions about the value of these chemicals. And in certain uses, a human life is worth a lot, right? So it's like,
right.
And so I think the ultimate goal I'm an agronomist, not a medical practitioner, but the ultimate goal in medicine is to find sustainable alternatives where that's possible without risking lives, I guess. So there's definitely a systematic approach to trying to find sustainable alternatives, assessing the risk of whatever it is, how persistent is it, does it bioaccumulate, how toxic is it, and then identifying where that chemical is being used. I think right now we really, like I said, there's so many thousands of them. We don't have a really good handle on where they are, where they're being used, things that you wouldn't even think about, dental floss, for instance. It's like, there they are. So getting a good documentation of where they're being used and what functions they're playing, and then identifying alternatives that could play those similar functions and assessing the performance and hazards and economics of using those alternatives. I know we've done that for mercury, for instance, right? And there are organizations like the Lowell Center for Sustainable Production that are looking specifically at, they have a publication on mercury, and I think they're shifting to look at PFAS as well.
Okay. You do bring up a good point. We don't really even have a comprehensive inventory of where this is occurring within our, supply chain today. And that presents a tremendous challenge as we think about how on earth are we even going to begin, to quantify this and address it.
Yep.
Yeah, for sure.
Yeah.
So you touched on health, and I really think that's a big one here. I know as a researcher focused on agronomy, you really are wanting to stay in your lane here. So I'm just going to point our listeners to the EPA's PFAS website for more information and specifics on human health effects. But if you do look at that info, you will see that it touches on things like reproductive health, developmental health, as well as various forms of cancer. So it's certainly very much a concern. What concerns do your team tackle to respond to the threat of PFAS?
Sure. Thanks for that question. First, I do have to say, while it's outside our lane, we are very concerned about the health risks for farmers and for farm workers.
Sure.
And because this is a podcast for medical practitioners, it's worth talking about those unique risks that those people have because of where they work and where they live. They're exposed to more PFAS if they're on a contaminated farm than your general population. And so there have been there are some guidances for medical providers from the National Academies of Sciences on how to work with patients who have had high exposure rates. In Maine, there's I just want to give a shout out to Dr. Rachel Criswell, who's at the Reddington Fairview General Hospital in Skowhegan, who's done a lot of work in this area and has found that people who are farming can have levels of PFAS contamination in their blood that are equivalent to people who work in factories where they are exposed to PFAS, like producing PFAS. And so at the highest, the high range of our exposure levels. So it's a huge concern. And actually in Maine, one farm, a farming couple decided to leave their farm just because of the exposure risk. So it's huge. And there are some promising things like they're looking at a cholesterol drug, cholestyramine, to remove PFAS from the blood. So, and there are other people working on looking at dust exposure and all of that on a farm. But for most of our work, what we're really focusing on is helping farmers understand and respond to contamination on their farms in terms of producing food. And so at the University of Maine Cooperative Extension, for instance, we are producing educational resources for farmers and for gardeners. We have fact sheets, and we have an email address that people can email us with their PFAS questions. We're also coordinating a network of we call them agricultural service providers, so people who work directly with farmers on anything dealing with PFAS. We have this network across the state where we're making, that we meet monthly to make sure we're communicating with each other, coordinating our information, keeping up to date so that we're giving consistent information and guidance to people. And we also do some outreach events to raise awareness and give people the opportunity to ask questions. And then there's this whole area of research that's been prompted by the crisis in Maine, and everything from crop uptake studies to animal depuration, that's where you excrete PFAS out of your system, to using biochar and feed binders and wild-crafted foods, like fiddleheads or game and fish, testing technology, consumer response. There's a huge research response going on in the state that's pretty exciting.
So I'm interested in your research a little bit. Maine certainly it's a rural state. It's a state that depends on farming, and although we've seen a consolidation of things like potato farms in the northern part of the state where I'm from, we've actually seen overall a growth in the number of farms across the state. And I think most people would be surprised to know there's more than 7,000 farms now in the state of Maine.
Yeah.
That's a pretty impressive number.
Yep.
So your research is really helping folks that are engaged in farming activities. I'd like to know a little bit more about the research work that you're doing.
Sure. Yeah. So the research that I'm working on specifically really focuses on forage crops or plants that are fed to dairy and other livestock animals. And part of the reason for that is that we've found that and when I say we, I mean I'm talking about a huge network of people in the state doing all sorts of activities from state CDC and Department of Ag, and anyway, that's just. But overall, we have found in the state that a particular PFAS called PFAS tends to be most prevalent across the farms that are contaminated, and then and that works its way from the soil to plants, and then plants into the animals, and it bioaccumulates in the dairy animals and appears in the highest quantity of any of the PFAS in the milk. And we know that milk is really important, especially for children, so it's high exposure level. So that's our focus, really, is on PFAS movement and because I'm an agronomist, I'm talking about from soil to plants. And so we're looking at how different species of forage crops and different soil and plant factors might affect that uptake. How could we manage those forage crops in different ways that might minimize that uptake, the amount that ends up in the plant? Can we apply biochar, for instance, to try to lock it up in the soil and not let the plant get at it? And so, those questions, we're working in a team that then we have animal scientists looking at ways to manage PFAS in the animal system, and we're also working with a environmental engineer who is looking at the manure side, actually, like how can you break this cycle? Like, let's not put it back out on the fields, and are there ways to isolate the PFAS out of the manure itself?
Wow, that's huge.
Yeah.
So what's the situation right now for farmers here in Maine?
Yeah. Well, so I think that it's important to, it sounds so dire, right? Like, and there's been a lot of news about PFAS in Maine, and so that can give the impression that Maine is, like, PFAS are everywhere on farms and we're in big trouble. But the Department of Environmental Protection and Department of Ag, Conservation and Forestry, since 2022, 2023, started systematically testing sites where there have been licenses for sludge and septage, so that they can find the areas that are of concern, where the levels are high. And so as of this spring, there were 90 farms that were identified, and that's 90 out of that 7,000, right, over 7,000 that you mentioned. Those 90 farms that have a soil test that is above the screening level that they've set for PFAS, or a water test that's above Maine's interim drinking water standard, or both. And so that's 90 farms, but I will say that only a handful of those have had to cease operation because of contamination. So there's a lot of ways of managing PFAS on a farm, maybe just as simple as not using the fields that are most highly contaminated, or installing a water filter if you've got a groundwater contamination problem. But then we can also do things like altering what crops are grown, because PFAS, or PFAS in particular, tend to accumulate in the leafy portion of a plant and not in the fruit or grain. So grow tomatoes instead of lettuce, or harvest corn for grain, or snaplage, which is just the cob and grain and husk, instead of the whole plant for silage, and feed that. So those are some of the ways to manage, and then there's there's a whole answer on like all the assistance that's available for farmers in the state, from financial assistance to technical assistance, to there's even land buyback programs. So the state has a huge response program, and then also a couple of nonprofits have been trying to help fill gaps while they can in terms of that kind of testing and farmer wellness programs. And of course, I would be remiss if I didn't mention that there's also crisis support that farmers can tap into if stress levels are getting really high or that, and that those resources are available on extension publications and websites if that's needed. Yeah.
So what can individual farmers or maybe even home gardeners do if they're concerned not just for the product that they're growing or tending, but also their own exposure to PFAS?
Yeah. Well, I think this area is causes a lot of worry,
Sure.
a lot of stress, right? So taking a very systematic approach, thinking through like, okay, why do you think there might be a reason for concern? Is there? So some of ways to look at that then are, well, has there been contamination identified in your area, in the water source near you? And we have a whole guide on how to investigate risk on farms. Extension does. There's a publication that people could look at. But we also have a publication in Extension on understanding PFAS and your home garden that kind of walks through these steps as well. So, if you feel like you have reasonable reasons to be concerned, then testing is the next step. And testing is expensive and for soil can be complicated. And interpreting the test results can be a little daunting.
Right.
I'll say the first time I saw a test result, I was like, what is this? But so for most people, it probably makes sense to hire somebody to help them with that testing piece of it. And then if you do find that you have an issue, then reaching out to Extension or to state agencies is pretty much the next step. And there's, in some cases there is assistance that's available. And I'll just say the CDC has been really great in terms of these kind of health questions. If you have a concern about, can I eat, such and such out of my garden,
right,
or my chickens and eggs or whatever, they field those questions and are really helpful.
So lots of resources, but clearly the Extension is an important conduit for that information.
Yeah, I mean, if we can't get you the answer, we can get you to the people who you need to talk to.
Sure.
Yep.
So Maine, I think, is regarded pretty widely as a leader in PFAS tracking. Do you agree with that? And although we may not have all the answers, should we be concerned or encouraged by the progress we've made to date?
Yeah, well, I would say encouraged, of course.
Right.
But, and yes, I do think that we are seen as a leader. I'm on a couple, national groups, and people often say, wow, what you guys are doing in Maine is so far ahead. There's some circumstances that led to that, that, are somewhat unique, I guess. But we have, for instance, we have the only action level to guide whether milk and meat are safe for consumption.
Right.
Relative to PFAS, again, that one chemical. No other state has that. So this question of how much is too much, a lot of people are just kind of stymied because, like, well, we could test, but then we get the results back, and
how do you interpret
How do you interpret it, right? So the CDC established those guidelines, again, for milk and meat, and that has really helped the efforts in Maine to identify sites that are of concern. And so I guess I say we should be encouraged by Maine's actions, because I think, on the one hand, we could say, Maine has this problem, we're associated with this problem. But on the other hand, we can say, we've gone further than any other state in actually identifying areas that are unsafe, but the vast majority of farms and sites are safe.
Right.
So I think that's a really important message to put out there.
Sure. Ellen, this has really been a meaningful conversation. But before we wrap, any final thoughts?
I think just along that line, I think we in Maine should feel really proud of the work we've done to address the PFAS crisis. It's still huge, and for individual farms, it's devastating. It can be, right? But I think because Maine is a small state and we have really close connections, one of the things I've been most impressed by is how we've been able to work together, bring all of our available resources to the issue. And so we have collaborations, Farmers First, who have been working with folks to look at, do the initial research that has led to some of these action levels being established. The CDC, the Department of Ag, Conservation and Forestry, the Department of Environmental Protection, the university, the nonprofits. It's really, like yesterday we did a sampling, and I'd say pretty much we had representatives of all of those groups out there in the field together. And I think it's only by working together like that we'll really address this problem, and we've gone a long ways towards that. So
important work, and we're very thankful you're helping to lead that. Thanks so much for being our guest today.
Thanks for having me.
Sure. For our listeners, we'll link to the PFAS Research Initiative and the EPA's PFAS Health page on our website. Until next time, I'm Tim Doak, asking you to think sustainably.
Thank you for listening to this episode of Sustainable Healthcare. Please join us next time for a new episode. There are several ways you can tune in. On our website at northernlighthealth.org/healthyhappywise. We are also on Apple, YouTube, and Spotify, which makes it easy for you to listen on the go on your favorite app.